Hi, my name is Liana West. I am a certified OEI Level 2 therapist, and I've been using OEI, Observed and Experiential Integration, which is a powerful set of trauma therapy techniques with hypnotherapy to accelerate the results for my clients. And in this series, we're going to explore the origins of OEI, the mechanisms, applications, and scientific evidence behind OEI. We're going to take a look at OEI and its unique approach to healing trauma. OEI stands for Observed and Experiential Integration, and there's a 68-page APA journal article, and I will put a link to that in the description. This is an introduction to OEI, and it starts with one of the creators, Audrey Cook. She originally trained in focusing, which is a bottom-up psychotherapy by Dr. Eugene Gendlin, and it emphasizes a close observation of physical and emotional shifts in the body. Audrey is also trained in NLP, which helped her develop the ability to observe eye movements. And in 1994, Audrey trained in EMDR, eye movement desensitization and reprocessing. But she found that EMDR was too intense for people who had experienced complex and sometimes multi-generational trauma, like her First Nations clients here in Canada. And this led her to experience and evolve EMDR to OEI therapy, which uses just one eye at a time to reduce the intensity of EMDR. Because even though EMDR is recognized as an effective treatment for trauma and PTSD, clients can often encounter significant challenges with EMDR because they often feel overwhelmed as they recall distressing memories inside of the EMDR procedure. They struggle with the emotional intensity of that revivification during their sessions. Others find it difficult to access or verbalize deeply held traumatic experiences inside that structured procedure of EMDR that can often feel rigid for those who need something a little bit more gradual and flexible. One of the OEI techniques that Audrey created is called switching, which is just the simple act of covering one eye to change the level of intensity of what the client is experiencing. She also noticed that the client would blink, halt, or hesitate when they were moving their eyes side to side while recalling traumatic memories in EMDR. And by using these points where the client was blinking, halting, or hesitating, she could actually activate and dissipate trauma-related intensity. This is called glitch work. There's also another technique called sweeping, which was inspired by Brain Gym. It's having the client following a hand that's moving in a sideways figure 8 pattern, which stimulates both sides of the brain and helps clients integrate both sides of the brain. And when this is done with one eye at a time, it helped clients process somatic, sensory, and emotional symptoms that they were feeling in the body that were linked to trauma. Clients visually follow the therapist's hands from the peripheral vision to the midline and alternating back and forth using one eye at a time. And this was found to facilitate traumatic resolution and resolve symptoms like headaches, numbing, and improve overall integration, and was further refined for emotional processing and trauma clearing based on direct clinical observation. Dr. Rick Bradshaw has been co-developing OEI with Audrey Cook, and he also presented a 15-minute TED Talk, which I will link in the description. He talks about OEI techniques that have been discovered and developed, and shows a video of someone having these emotional slivers of trauma being pulled from their eyes. He also provides case examples and suggests the eye and brain mechanisms that are likely responsible for OEI being so effective for trauma recovery. Why does OEI use visual instead of verbal pathways to work with trauma? What is it about these therapies that use those visual pathways to healing, like EMDR and OEI therapy? It really goes back to the triune brain model, where our brains have three main levels: the brainstem, the limbic system, and the cortex. Trauma impacts the limbic system, that middle part of the brain, which includes the amygdala, which processes emotion, the thalamus, that processes sensory input, and the hippocampus, which works with memory. Talking and listening about trauma works at that higher level of the cortex, but the lower brain levels, the limbic system and the amygdala that processes all the emotion, can actually overwhelm the higher levels of the brain. And it causes the cortex, that part of the brain that thinks about things, that makes really good rational decisions and figures things out, it overwhelms the cortex with so much intensity that it makes it difficult for the cortex to suppress these lower level responses. It's this middle layer, the limbic system, that's most affected by psychological trauma. Talking and listening involves the highest of our brain layers, the cortex, but the limbic part of the brain that is involved in producing intense emotional symptoms like panic attacks, flashbacks, the startle reflex, tightness in the chest, airway and throat constriction, and nausea, those all emanate from the limbic system. This area of the brain doesn't understand language. It does not compute. So they are not directly affected by talking or listening. The amygdala, which is responsible for the most intense symptoms of PTSD, is below the surface of the brain where speaking and listening functions are. This is the anterior cingulate gyrus. It's towards the front of the brain. And this area registers both physical and emotional pain. And it also serves as a threat detector when someone has experienced psychological trauma. There was a study where trauma survivors were triggered into post-traumatic states by listening to short audio recordings of individualized trauma narratives. Listening to these narratives triggered trauma survivors into their post-traumatic stress. So when these recordings were played during fMRI scans, they saw that regional cerebral blood flow was greatest in the back of the right brain and lowest in the front of the left brain, known as the Broca's area, which is the speech center. So that means when people are triggered into their traumas, it's hard for them to describe their experience with words. And words actually trigger survivors back into their post-traumatic states. Many trauma survivors, many people are confused by their own emotional and physical reactions to sources of stress and triggers to trauma. And many survivors are actually dissociated from or numbed out to their own reactions. OEI therapy allows people to explore their physical and emotional responses. OEI therapy allows clients to explore their physical and emotional responses to trauma in ways that are informative and therapeutic and not overwhelming. One of the most common uses of OEI is to reduce physical and emotional intensity. So many common psychological disorders include emotional dysregulation that are so debilitating. And for this reason, OEI is extremely valuable to add to any psychotherapy intervention. In the next video in this series, we're going to look at the early development of OEI with childhood adverse experiences. Subscribe and like this video for more content on OEI therapy. Let me know if you have any comments or questions, and let's connect in the next one.